Hi, I'm Dr. Turchin, and I'm the developer of LiteForce Technique. And what I want to explain to you is why I developed LiteForce Technique and what is unique about it. The problem you're going to find as a doctor or therapist is that it's very difficult to find techniques to mobilize the spine or extremities that are both gentle and very, very effective. There's lots of gentle techniques that are quite ineffective and quite slow at creating pain relief for the patient. There's also rougher techniques like what they call high velocity manipulation, adjusting, or bone cracking that can produce dramatically positive results, but also pose more risk to both the therapist, doctor, and patient. Even many mobilization techniques can be quite severe and stressful on the patient. After having studied with some of the greatest doctors and therapists, I learned a tremendous amount about what was effective. And from this learning, I developed what I call Lite-Force Technique, a technique that is both gentle, effective, and scientific. I was thrown into this technique because of a very tragic injury where I lost 2 fingers that had to be amputated due to a brown recluse spider bite. 1 year later, believe it or not, this was a bad couple years for me, I also had to have back surgery for a ruptured disc working on a patient. So now I had chronic back pain for 5 years and chronic hand pain for 5 years and needed techniques that were effective and yet gentle on my body. The ironic part of this is by learning these gentle techniques which I developed, I found that the patients told me they were getting better faster and they felt less discomfort during therapy. So the irony, of course, is that these techniques are not only gentler, but they're also more effective. So what you're going to see in these videos is how to use Lite-Force Technique to help more patients get better faster. You'll help more patients, you'll have a lot more fun, and you'll make more money. That's a side effect of doing something that is very effective and very gentle. I call this Lite-Force Technique because the forces the doctor or therapist use are quite gentle. I also call the movement the patient makes innate mobilization because the patient is moving their body in a way that is innately correct for them so that when the doctor or therapist provides the treatment, they're doing something that the patient's body actually needs. Newton's third law says that for every action, there's an equal and opposite reaction. And that's the problem with mobilization and manipulation techniques that use this type of prone posture for the patient to move, stretch joints, causing what's called mobilization or manipulation. This requires a lot more force on the part of the doctor or therapist than Lite-Force techniques where we use innate mobilization. So Lite-Force Technique uses what I call innate mobilization, meaning the patient's making some of the movements, so we have the exact right contact and movement. And what you'll notice is you'll find that in most patients, one side is much tighter than the other, and that prone technique does not give you that kind of information. And lastly, this is very easy on the patient and very easy on the doctor or therapist. Each video is very short, and I made them short because that way it will fit into your busy lifestyle. It's not going to take you a lot of time to learn this revolutionary technique. And you'll also find that by having these short sections with a very quick video and then a very quick 1 or 2 question test, you will learn this information very quickly and very easily. If you're a clinician with a lot of skill, you might find yourself going through these videos quite quickly. However, I think most doctors and therapists may refer to these videos a number of times, and that way you can get the fine points of this very interesting and effective technique. If you want to become a black belt and really learn this technique in depth, and I think you will, you can click on the seminar button and learn how to get individual study in small groups of other doctors and therapists who want to learn LiteForce technique in greater detail.